Today we're going to talk about lateral elbow pain, also known as tennis elbow. It's usually a common overuse condition seen in people like office workers or heavy weightlifters, and it's usually comes about after doing something like a repetitive task. So if you're doing a lot of typing every day, if you're doing a lot of leg work every day, or a lot of heavy lifting like I was saying. So common signs and symptoms are pain right on the lateral part of your elbow. Sometimes it can radiate down into the forearm. Sometimes it can be just above the elbow as well. Usually you get problems with grip or carrying heavy bags like groceries, or doing things like typing constantly, or your workouts, so pull-ups, bench press, things like that. So those are some common signs and symptoms of tennis elbow or lateral elbow pain. I'll show you a couple really easy exercises for elbow flexor and extensors. So these are just eccentrics with a light dumbbell. So you go 2 to 5 pounds, nothing too heavy with this, because you're going to be doing about 2 to 3 sets of 10 to 15 reps. And with the eccentrics, what I mean by that is you're going to be going slower on the lengthening portion, and then you're going to come up a little bit quicker on the raising of the weight. So what I mean by the eccentric part here is for the wrist flexors or the forearm flexors here, you're going to have your palm up towards the ceiling, and you're going to slowly lower down about 4 seconds, and then come back up in about a second. Slowly back down, 4 seconds down, feeling a stretch right here in your wrist and forearm flexors. And then you're going to flip over, palm facing down, 4 seconds down, 1 second up, feeling it on the top of your forearm here. So the first few reps you're going to feel pretty easy, and you're going to feel like, what's the point of this exercise? But at the end it's going to be pretty tough, and you'll feel a pretty good stretch or burn through your forearm there. So this is just an easy local exercise for elbow pain. Usually with elbow pain there is a common cervical or thoracic spine component to this as well. So it's not just pure elbow pain, so it's not just where the side of the pain is. There's usually some neural tension going on, or maybe some weakness in your shoulder joint or your scapula. So it's good for this one, especially if the pain lasts about 2 weeks or more, to go seek a health. All right, so remember, these are just some tips and tricks to help manage the pain. If you find that your pain isn't getting better, or if it's even getting worse, then it's a good idea to go seek a health practitioner, someone like a chiro, massage therapist, or even a physiotherapist.